So hello and welcome you all to Sail to MDS Dental Academy. So aspirant, today we are here with the part 7 of the HPSC Past Paper discussion. So let's start with the present video. So what DPT vaccines stand for? It stands for the diphtheria, whooping cough and tetanus. So P here is pertussis, which is known as whooping cough. What's the golden proportion? It is 1:1.618. Please remember aspirant this value. So now aspirant, you can get your golden proportion to this simple equation, that is frontal view of NDS60 divided by 2 into 1 plus RED, that is a recurrent aesthetic dental, plus 2 RED. Okay, and so you're going to get your value, that's a 1:1.168. And remember the different value, like here is a 0.6 for your canine, 1.0 for your lateral incisor, and 1.6 for your central incisor. And remember always aspirant, this recurrent aesthetic dental is always 70% proportion, not more than that. Now most preferred impression material for recording implant impression is polyether impression material. The polyether produces the most accurate complete arch replica. The second most accurate were the vinyl, polysiloxane followed by polysulfide, and the irreversible reversible hydrocolloids. Stretch breaker arc indicated for use when the clinical examination reveals that the residual ridge is strong and the teeth are weak. Now aspirant, split palate stress breaker. So stress breaker for maxillary partial denture is often not necessary because there is a more alveolar ridge for support. But in the cases where there is a Kennedy class 5, your partial denture may be difficult to design because you cannot place rest on the weak lateral incisor. So your second molar has to absorb most of the load. So in such cases you can go for the split palate stress breaker. Then a Bennett shift is what? It is the bodily shift of the mandible on the walking side. Most often you get confused between the walking and balancing side. Always remember Bennett shift is on the walking side. Balancing ramps are made in complete denture, which uses which type of tooth? They use 0-degree teeth. That's a non-anatomic teeth. So as you can remember the definition of Bennett movement, that's a bodily lateral movement or lateral shift of mandible resulting from the movement of condyle along lateral inclines of the mandibular fossa during lateral jaw movement. Then the incisor guidance is what? It's governed by phonetics and aesthetics. Sibilant sounds are produced at what? It produced at position which is open from resting position. Then aspirant, modulus at the corner of the mouth is formed by all of the following except masseter muscle. Remember in facial anatomy the modulus is what? It's a chiasma of facial muscle held together by fibrous tissue located laterally and slightly superior to each angle of mouth. It is very important for facial expression. It is extremely important for stability of lower jaw also. And it derives its motor nerve supply from the facial nerve and blood supply from the labial branches of facial artery. So here in modulus we have the orbicular oris, buccinator, levator angular oris, depressor angular oris, zygomaticus major, rosarius, quadratus labiae superioris and quadratus labiae inferioris. And which of the following clinical requirement is not required in order to produce an acceptable functionally generated record of mandibular movement? We don't require a fully adjustable articulator. Now both research and our textbooks state that the most important factor in RPD is what? It is plaque control. Then if the path of dislodgement is controlled, an IVR is often located in 0.01 inch undercut in which area? At the greatest mesodistal curvature of the buccal or lingual surface. Then gagging reflex is caused by which nerve? By your glossopharyngeal nerve. Now aspirant, when should pour polyether impression material? Within 24 hours after taking impression. So aspirant, that was all from the part 7. If you want to join test series for the government dental exam or NEET MDS, you can contact me. And if anybody have not watched the remaining 6 part, they can watch. The information is there in the description box. And any doubt related to your preparation, you can let me know. Till then aspirant, take care and keep on working.